The Privilege of Health, Inequity in Healthcare. In our modern society, there are advancements in science, research, and practice that allow healthcare and contemporary medical practices to improve. New technology, less intrusive surgery methods, and best practice approaches in everything from obstetrics to hospice care are on the horizon each day, for the lucky few. Are you one of them? In this presentation, we will explore the following topics: an introduction, what is socioeconomic and social inequity, and how does it impact healthcare? Davis's story, how gender discrimination impacts the quality of care for some individuals' lifelong health, the importance of quality healthcare from birth, big problems, how Medicare in the United States is failing, and proposed solutions. What is the plan for improvement? So, what is inequity, and how does it impact healthcare? According to the dictionary, inequity is defined as a lack of fairness or justice. Socioeconomic disparity and marginalization shapes how individuals in our country not only receive or don't receive health care, but also how that inequity affects their future lives in many ways. Our original model of health care as a social practice has been a flawed one. As related to just one factor alone, income, let's examine mortality amongst different socioeconomic groups. Keep in mind, this doesn't include how race or gender impact inequality when it comes to discrimination. If you look to the chart on the left, you will see how income inequalities affect mortality rates. Money does equal health, and income inequality is regarded as an important driver of health status in industrialized nations. Health services in our society can rightfully be thought of as a commodity. Those with more money can afford more services. Despite recent changes in our country, the United States is still trailing behind the success of other countries with government-funded or socialized health care, which is the most successful by far in many areas statistically. Consider the infant mortality rate in different nations comparatively. The United States, despite its perceived affluence, has a death rate of 5.9 infants per 1,000 births. When compared to Sweden or France, both countries who have socialized health care, that figure drops nearly in half. Of course, more poverty equals more death. Unfortunately, Sierra Leone, a coastal West African country, had an average in 2013 of 100 infant deaths per 1,000 births. But that's not the whole story. Though the CDC gives an average in 2013 of around 5 infant deaths per 1,000 births in the United States, when we examine solely African American births, we find that number more than doubles in size. The African American infant mortality rate is 11 deaths per 1,000 births, more than double the American average of all races combined, which is 5. How about gender? How does gender or perceived gender, including progressive or non-binary ideas about fluidity, impact the quality of health care for some individuals, especially those who identify as transgender? This is Davis's story. Davis is a transgender woman from Michigan in her late 30s. Her experience with insensitive treatment, misgendering, and refusal to accommodate her identified gender at the doctor's office illustrates the health of transgender individuals as impacted in our current healthcare model. In a recent interview with Davis, it was discovered that unfair treatment is a regular part of her healthcare experience. I wasn't afforded a female third party in the examining room during a physical with a male doctor, she said. They said I didn't need one legally since I still had my parts. Davison also shared, I've also had many embarrassing situations where, even if I ask the desk staff in medical offices not to say Mr. Nicholas when they come to call me back, the message doesn't get delivered and someone asks the waiting room for a Mr. Nicholas. Tons of he and him at the front desk, even at my endo's office, who is doing my hormone replacement therapy. When asked the question, how do you feel that these sort of issues impact the transgender community when it comes to treatment, particularly preventative care, Davis responded, "Avoidance is huge. I won't go to a dentist because I'd feel too trapped on the seat, totally vulnerable and exposed, and being stuck and literally unable to speak while being misgendered or disrespected would be too much." The idea that people would miss out on preventative care is very predictive of their overall health. So why is preventative health important? Lower income individuals have even more risk for illness, yet less preventative care. The following negative health ramifications are associated with lower income individuals and can also both be prevented and treated successfully with preventative measures: higher incidence of infant mortality, low birth weight and higher risk of death the first year of life, asthma, obesity, varying causes of injury, and mental health issues. It really does start from birth. All of these health risks, including support for chronic stressors, should be addressed from day one of a person's life. A direct quote from the Pediatric Child Health states that children's level of impairment of functional health, for example, vision, hearing, speech, or mobility, may affect their performance of certain activities and their ability to engage in activities with other children of the same age. The opposite is also true. Proper support and health care from birth are the markers of future success into adulthood. In addition to poverty and both racial and gender discrimination in healthcare, how is our Medicare system failing senior citizens in this country? Consider this: nearly 1 in 5, or 19% of Americans 65 and older, say they had a medical problem but did not visit a doctor, skipped a medical test or a treatment recommended by a doctor, did not fill a prescription, or skipped doses of their medicine because of cost constraints. By comparison, a far smaller share of elderly Canadians, British, and French, all of whom have government-funded health insurance programs, reported cost-related constraints on access to health care. Recipients of American Medicare say they have trouble paying their bills and receiving same or next-day medical care. They also struggle with paying out-of-pocket for medications and medical expenses. So what's the problem? Many argue on what exactly must be done to correct Medicare issues, but some of the most identified issues are increased population aging, or more recipients of Medicare, increased cost of technological advancements, budget cuts, and disability benefit funds that are running out as soon as 2016. As we look at all of the issues and inequity in our current healthcare model, how can we tackle inequity and improve our system? Some ideas include introducing more diversity within healthcare professionals, or promoting the inclusion of professionals of different races, cultures, and identities to properly serve a diverse community, and maintain that our healthcare system is a balanced social practice. In order to serve society in a culturally competent and equal way, there must be changes to the internal model. We must strive to provide access and care for everyone through government-funded healthcare programs that alleviate costs and promote universal healthcare as a fundamental right rather than a privilege. We see other countries doing this successfully around us, so why are we not able to take notes? The attitude of the American healthcare model is stubborn and non-intuitive. Finally, our healthcare system must advocate for gender discrimination and beyond, creating diversity within the social practice of healthcare and introducing ethical practices for treating people of all gender and preferred gender constructs fairly. No matter what our structured plan for the American healthcare system is, it stands to reason that true equality won't be achieved until we recognize the diversity in our country. As stated by Commonwealth.org, cultural competence in healthcare describes the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery to meet patients' social, cultural, and linguistic needs. It is due time that our healthcare system recognize the melting pot that it truly is.